of looking at that. So you mentioned the way we measure. And I'm watching in some industries to where if we look at our typical measures from an administrative perspective, we're looking at, NOI, we're looking at return on capital, we're looking at all these different types of things that a patient may not really care about. And I think our surveys, I have a little bit of a disdain for surveys because what people say, sometimes they're just saying it to be agreeable. Sometimes they don't know how to tell you what they're struggling through. So I've thought about how do we get to the point that we understand what I call the love metric. What would patients love to experience when they come with us? And it's not a quantitative, it's a qualitative thing that we somehow have to get to. But I thought, how do we get to that? How do we get to really measuring the things that they truly care about, such as get me back to work, let me walk with my kids? What have you seen maybe in successful cases where we're really starting to measure the essence of what people desire versus typical corporate measures? Because I think we need to do both. Mm-hmm. What are you seeing?
I am on a mission to find a metric for well-being or resiliency. And we at Vocera are part of a national task force led by Dr. Bill Maples and Dr. Ron Paulus and David Strand and Abundant Ventures, and we'd love you to be part of this. Awesome. I think if we had a metric for well-being or resiliency before we deployed any process improvement or any technology, that we could actually put a stamp of approval on solutions that actually touched patients' heart or improved the outcomes in healthcare today. And so we're on a fast track to come up with that metric and what it looks like. And if we actually looked at that metric before we deployed Cerner or Epic, I mean, they hit the valley of despair. We would have done things different in the deployment. We need a central database for records, but maybe we would have done it different, and maybe we would have engaged them differently to ease the burnout. But that is the number one cause of burnout in doctors and nurses is the data entry piece. So I think if we, instead of just chasing AIDS caps or quality metrics, if we actually focused on the right end of the bat, and that would be a metric for resiliency and burnout and designing for people, we would actually move the needle in healthcare. We spend so much, and we have stripped out everything, and we've not really moved the needle in healthcare in America, and that's because we've not designed for people.
And I think we need to get there. Maybe one more question. Is that okay? One more question, because it's after 10:30.
Okay.
I've seen so much in this term of digital health. I don't believe there's such a thing as digital health. I believe it's human health, and maybe digital is a way for us to better understand, to your point, to connect to humans. What's your view of it? You've been very passionate about this for a while. I just think that narrative needs to be refined. What do you think?
Well, I find it ironic in the digital health era with more technology than we've ever had that we've burnt out a generation of doctors and nurses, and we have a dissatisfied patient consumer. So I think you're absolutely right that it's not just about the technology. I'll have a doctor say to me, Bridget, I've had 200 people in here trying to sell me this thing that deals with this small part. I know what we're trying to do at Vocera is create a seamless, consistent, compassionate communication experience where it's from before people arrive till after they leave. And that's how we have to look more holistically at how we deploy technologies to create a seamless experience from the patient's experience and for doctors and nurses. Doctors and nurses like me often walked into the hospital or the emergency room and said, please God, don't let me harm anyone today, because we lived in fear that we wouldn't get the right data sent to us or we would have missed something. But if we could have technology that actually restored humanity and eased the burden, I think healthcare would be improved overnight. So instead of just throwing fragmented piece of technology, we need systems of technology that are connected, that improve the experience for everyone.
So last thing, it's been delightful finally getting to sit down with you. If there's anything you would like for us to remember, you're on a mission, we're with you, we want to be on it with you. What do you want people to remember? Keep at the forefront of our minds as we try to improve the experience for caregivers, whoever they are, a doctor, a patient, a family member. What would you say?
we have to restore the narrative, the patient's story back to healthcare, and we have to engage and listen to patients different and better because we are in the human-to-human industry, and we've got to start designing for people.
Awesome. What a pleasure.
Thank you. It's
So
absolute
nice
treat to meet you.
Good to see you. Thanks
Thank
a
you.
lot. Bye-bye.